Hello everyone and welcome to Group 5's presentation on interprofessional practice. This week's focus is on workplace realities and nursing practice issues. Some of the topics we will cover include defining interprofessional practice and related terms, discussing what makes interprofessional practice successful and its value to the nursing profession. Please meet your tour guide for the presentation.
This image focuses on the feelings a patient may have when their healthcare team is not functioning as such. When a patient has many different professionals working in their care, yet all of those professionals are disassociated from one another, a patient may struggle to open up and create a relationship with that person. When a patient knows that their concerns will be shared from one professional to another within their team, they start to feel as though they are valuable rather than a burden on their healing journey.
The following video is a case study of Amina, which demonstrates the importance of interprofessional practice. Although some parts are specific to an educational program, please focus on how the healthcare professionals in this video collaborate together to achieve a positive health outcome for Amina.
Amina is striving to manage her diabetes and maintain her health. She has a key role to play on her care and learning team. Amina uses a mobile device to stay connected to her team. Each morning, Amina measures her blood sugar. Today, she noticed it seemed high, as it had been yesterday. Her glucometer automatically reports her glucose measurements to her local community health center, which is funded as a federally qualified health center. Linking education and healthcare delivery systems. A few years ago, the university administration identified faculty and provided resources to create a curriculum committee, whose charge was to redesign the health sciences curricula to advance the triple aim and create a nexus integrating practice and education. Now, students learn together in courses, rotate through communities in interprofessional teams, use state-of-the-art learning technologies, and are assessed for team competency throughout their education experience. For several months, students are placed in one health system so they have time to fully engage in care delivery, complete quality improvement projects, and add value to sites. Building innovative partnerships. Amina's Health Center partners with the Somali Community Development Alliance and the university to ensure members of her care and learning team deliver her care in a coordinated and culturally respectful way. Because practice is integrated with the educational system, patients and learners experience a new meaning of quality. And the partnership demonstrates shared responsibility for the health of people like Amina, as well as for the health of the community. The partnership between the FQHC and the Somali Community Development Alliance provides a team-based, patient-centered health home, with the patient, community, providers, and learners as part of the team. The results of the partnership. Population health in the urban community is now similar to that of the suburbs. Transforming healthcare for Amina. The computer that receives Amina's blood glucose reading reviews her record, recognizes an increasing deviation from her usual pattern of control, and alerts others on her healthcare team. The team receives the alert via Amina's electronic health record and assigns the pharmacy student under supervision of a nurse clinician to engage the Somali community health worker. Speaking in Somali, the community health worker calls Amina and reviews cultural, diet, family issues, and Amina's current self-care protocol. Soon after, a conference call is initiated among the pharmacy student, nurse clinician, community health worker, Amina's primary care practitioner, and Amina. They develop a plan. Amina walks to the clinic a few blocks away, leaves a urine sample, and has blood drawn. A few hours later, following a treatment plan review, the pharmacy student discusses the urinary tract infection diagnosis with Amina and the community health worker. The pharmacy student confirms Amina's medication allergies and pharmacy of choice. Amina starts taking her antibiotic within 2 hours. Later that day, the team huddles and reviews Amina's case, including the FQHC care goals for diabetes and the care processes and outcomes. Healthcare students reflect on their interprofessional experiences with Amina and other patients. They update their electronic learning portfolios. A team of faculty, practicing clinicians, and community members assess each student's portfolio. They base their review on previously established profession-specific and interprofessional competencies and standards. Over the next few days, Amina sends text messages to the team members to update them on her symptoms and blood glucose levels. The other team members text Amina with information and reminders about her health goals, self-care plan, and scheduled group visit. Since Amina became a member of the care and learning team, she no longer requires frequent hospital and emergency care. Amina is now healthier and more engaged in managing her own health as a result of this new care model.
The World Health Organization states that interprofessional practice happens when healthcare workers across various professions are able to work together to deliver high-quality care collaboratively. IPP allows professionals to utilize their specific skill while being geographically in different locations.
Nurses are in a unique position to be able to access and coordinate the care that is needed, since our education affords us a general understanding of the skill sets of various health professionals.
Multi-professional or multidisciplinary refers to people from different disciplines or professions. Although each profession has their own role, it cannot be assumed that collaboration is being achieved. The term interprofessional focuses on the actual collaboration of healthcare providers as well as other disciplines outside of healthcare.
Intraprofessional encompasses collaboration between individuals from only one profession. Collaboration as a whole, on the other hand, is working together with one or more members of the healthcare team who each make unique contributions to achieve a common goal. Each of these individuals contributes from within the limits of his or her scope of practice and involves all members of the healthcare team as well as the patient themselves.
With those terms defined, let's move on to a discussion of why interprofessional practice is so important. As patients' conditions grow in complexity, so too are the services they require. With this complexity, a growing concern, according to McIntyre and McDonald, is the fragmentation of services provided. Like the comic from earlier in the presentation, if there is no communication between providers, then collaboration is much harder to achieve and can create patient frustration.
Interprofessional practice serves to alleviate this frustration by eliminating duplication, enhancing access to services, and reducing healthcare costs while utilizing providers to the maximum of their particular capacity. So the following video we have attached for you guys is various healthcare professionals sharing their opinion of why they think interprofessional practice is important and how it makes a difference in their everyday care for patients.
I think historically there's been this idea that the doctor-patient relationship, those two people, is the most important thing. And I would argue actually that that's not true anymore, if it ever was, that the most important thing is that the patient has a relationship with multiple members of the team.
That students should have the understanding that they're expected to function in an interprofessional practice setting in the community from the very beginning of their education. From the day they start medical school, nursing school, dental school, have the deans and their initial courses reference the fact and set up the expectation so that it's clear and they know that it's important.
For a very successful collaborative effort, everyone needs to have the same goal. Whether it could be to decrease hospital readmissions, or improve the patient experience in the waiting room, or better manage their medications. I feel like every professional needs to be on the same page.
Recognize the strengths and limitations of your own profession, and you'll reach outside to other disciplines to ask for assistance in managing a complex situation, and understanding that another discipline may be able to handle a situation better than my own, and then just being humble enough to ask.
I think it's really exciting that there is so much attention right now on interprofessional education. It's a theme that's close to my heart, and I think it really does improve outcomes for patients, and I think it also improves and contains healthcare costs. I'm hopeful that this is not a moment in history, and rather a transformative shift in how we think about healthcare.
Understanding one's own professional role is the ability to not only perform specific skills, but also know the value of those skills in relation to the team. Knowledge of the role of other health professionals is important to prevent duplication of services by utilizing each provider appropriately. This contributes to a more respectful and trusting environment and seamless integration of services that better meet patients' needs. Having the patient's goal at the center of the team's effort, effective communication, and teamwork also contribute to successful collaboration.
The following are various factors that contribute to IPP. Interprofessional practice can be viewed at different levels. At the micro level, personal factors are addressed. The knowledge, one's skill set, and an individual's attitude towards teamwork all contribute to the effectiveness of IPP. The meso level takes into account the environment, proximity, and the context of the healthcare team's work. The macro level is the largest factor into IPP and takes into account the healthcare system's priorities, government regulations, and the policies of various regulatory bodies.
There are three levels that pose a threat to the effectiveness of IPP. At the individual level is role clarity and trust between professionals. Barriers that inhibit role clarity and trust can, in part, be attributable to limited knowledge and understanding of other team members' knowledge, skills, and scopes of practice, making it difficult to manage and optimize roles within the team. As well, some professional groups have overlapping competencies or variations of similar competencies.
At the practice level, lack of leadership and difficulties establishing appropriate skill mix and team size, and inadequate tools for communication can be potential barriers. Leaders may be challenged to recreate themselves as facilitators of collaboration in which they often have little or no training and experience. As well, there is no one-size-fits-all model in terms of appropriate staff mix. Staff mix is highly reliant on the professional competencies or skills and experience required to address the health needs of the patient population.
At the systems level, there can be inadequate interprofessional education and training, suboptimal funding models, and a lack of appropriate monitoring and evaluation. One of the greatest and most important challenges in the optimization of IPP teams is its limited monitoring and evaluation. We know little about the health and economic impacts of past and current reforms towards IPP to the primary healthcare system.
Economic considerations. Economic considerations are a valued part of the nursing profession since maximizing efficiency to decrease cost while achieving greater outcomes is always desired within governments and organizations. Quality assurance, an important component of any healthcare system, will always include a cost-benefit analysis and accountability. Collaboration is one avenue for healthcare systems to increase economic viability.
This picture shows a group of people working together to treat a patient. In many cases, we will see doctors, nurses, the respiratory team, as well as other healthcare professionals working together to save patients. Collaboration such as this is and will continue to be vital in all healthcare settings, and nurses play a central role of assessment, delegation, and coordination.
The following image shows a patient's point of view of their healthcare team. This picture demonstrates that sometimes as healthcare providers, we forget that we are working as a team for the patient. The patient's point of view in this photo shows various healthcare services functioning as separate, independent entities. Interprofessional practices focus on merging all of these entities into one single unified body, which places patient care at the forefront. We would like to thank you for taking the time to listen to our presentation on interprofessional practice. Going forward, as we approach the end of our nursing school journey, it is important to remember our individual roles and know they are in fact important and valued as part of the healthcare team. Though there may be times we feel undervalued, knowing for who and why we are working as nurses will help bring back the focus needed to achieve the best possible patient outcomes.